My name is Kate Dalman. I'm a speech language pathologist. I've been with Ivy since 2016. I've been an SLP for almost 20 years, both in and out of the clinic. I specialized in treating TED oral tissues, infant feeding, and myofunctional therapy. At the very end of my career treating the clinic, I got into that through some experiences with my personal children having difficulties breastfeeding and feeding as infants. I just really love to bring that into the clinic and share that with everyone at Ivy. So a lot of the time we get referrals around 1 to 2 years of age when we would expect children to be verbally communicating, using words, using short sentences. But really SLPs, we can, always support communication in any way, shape, or form. So if that's gestures, social skills, feeding concerns, oral, motor, hearing, anytime there's any issues with any communication in any way, shape, or form, we're more than happy to support the family and the child. We even have the ability to pull in augmentative and alternative communication when appropriate. So I really would say if there's any concerns with your child's speech and language, feel free to contact your pediatrician and get them on in for a referral and an evaluation. I think a lot of what we can work on as SLPs is really kind of addressing oral motor skills. If there's any sensory concerns with feeding, a lot of times we get the kids that are picky eaters in their family that don't really love to eat fruits and vegetables and meats. That's a big one that we get to see. And really, we just want to best support the family and the child. So at meal times, at birthday parties, at restaurants, that they can participate in their family meal or whatever that might look like for their living situation, again, and addressing any other family goals that they might have throughout so that they can, again, better participate in what's going on outside the clinic. So as SLPs, we have so many tools in our toolbox that we can pull from, really pulling from the strengths of the individual child. We love play. We love what movies they're into, what songs they're singing at home. We really focus on building that engagement and rapport with both the family and the child as a part of speech therapy. Communication is a basic human right, and we honor communication in its all ways, shapes, or forms. Again, if it's gestures, vocalizations, verbalizations, augmentative and alternative communication. Really what we do with play, we want everyone to have fun when they come to speech, and really we work on all of those things that we need to address through play in order to get better communication. If we have kids that are having a hard time with intelligibility, so they're difficult to understand, we can do a lot of oral motor movements, a lot of articulation placement, so moving your tongue in the right place to make the correct sound. If we're having some issues with overall coordination, we can get the kids out in the gym. We can do obstacle course. We can really just, really work on supporting them and getting them to where they need to be. The relationship between the family, child, and the therapist is really so important. I know us as therapists, we want to support them to the best of their ability to go out and live their life to the fullest. We really want to start building a mutual agreement or a therapeutic alliance from the first visit. So what's important to the family? What goals do we need to address? Our goals are going to be patient and family focused. We want to establish really meaningful goals, again, to the patient, child, family that are being addressed both inside and outside of the therapy session. We know that our weekly sessions are imperative for success and progress, but learning should really happen outside of our clinic as well.